Welcome, South Africa. We chat to Dr. Art Singh, specialist dermatologist, a well-known doctor in South Africa that makes everyone's skin absolutely amazing. But our topic today is very sensitive, and we chat about vaginal relaxation syndrome and what it is all about. And Dr. Art Singh is going to give us an overview on this interesting topic. Doctor, welcome to the Get Real Talk Show.
Thank you, Denver. Thank you for having me on your show. It's always a pleasure to be on your show. And welcome to all the listeners, wherever in the world you are.
Yes, definitely. Nationally, everyone's listening to you everywhere in the world as well. So, what is vaginal relaxation syndrome? I mean, what is it?
Yes, you brought up a very important topic. First of all, let me explain something to you. I think it'll be a disclaimer, is that this is a sensitive topic. But at the same time, it is a topic where women suffer in silence. And as you're aware that a lot of topics that were taboo before are becoming very common now. For example, mental health was very, very taboo before. But today mental health is a topic, and you find how many people suffer from mental health. So the question is, what is vaginal relaxation syndrome? Vaginal relaxation syndrome is a syndrome which usually occurs in women over the age of 40 and in the childbearing woman. And when the woman over the age of 40 and the childbearing woman develops laxity of the vagina and the pelvic muscles, and therefore it affects most parts of the life. They can also develop urinary incontinence, their private life is badly affected, and it affects their self-confidence. With vaginal relaxation syndrome, the weakening of the muscles, there's looseness of the vagina. So therefore, this is part of the syndrome, which is known as vaginal relaxation syndrome.
Yeah. So, doctor, we're just going to go a little bit off the topic with this. We're still in the topic, I mean. But in terms of making someone understand from a very layman terms, is this only happens when someone gives birth, or is it happens over age?
It happens over age. It's not only restricted to childbearing women, but remember, everything ages in the body. The skin, the heart, the lungs, so even the private areas do age in the body. What you must understand, just to put you in perspective, the seriousness of the problem. Last year, I think according to statistics, there were well over 1 million children born in South Africa. Now, if you look, if there's 1 million children born in South Africa, and up to 25 to 50% of women are affected by vaginal relaxation syndrome, that's almost 500,000 women who are going to reach the age of 40 to 50, and they're going to be affected. Forget the women who already gave birth, forget the women who are menopausal, forget the women who are aged. So you can see that literally you're talking about millions and millions. And therefore, it is quite a serious, what I would say, problem. What happens is the women suffer in silence. And because they suffer in silence, there's been a whole new branch of medicine, which is known as aesthetic gynecology. And aesthetic gynecology is a whole new branch, so much so that the Europeans have got their own association. You even got the Americans have their own association of aesthetic gynecology. And what happens is that people are trying to help women, because what you must understand is that we are living in a modern era. And because we're living in a modern era, women are sexually active to a much older age. The second thing is women are much more aware of their health. And the most important thing is that longevity is around. So women do not want to have this problem when they are, for example, at the age of 80, 90, people are living, and some of them live to 100. Women live longer than men. So they're going to suffer longer than men.
Yeah.
So like some of the problems they can have is like, for example, they can also develop urinary incontinence with vaginal relaxation syndrome. So this is a problem that occurs. What you must also understand is that you must be wondering why a dermatologist is talking about vaginal relaxation syndrome and not a gynecologist. The new techniques that we use is not only restricted to gynecology, but it's also you can also get dermatologists, plastic surgeons, and gynecologists doing these procedures that help these women.
Yes, so we're going to take a short break, and I'm sure you would realize at this point it's a very sensitive topic and very age restricted. I'm going to put it up to about 16. Let's be a little bit sensitive about this, to about 16. So we'll take a short break, and we'll return with Dr. Art Singh, specialist dermatologist, with our very interesting topic. Welcome, South Africa. If you've just joined us, we are chatting to Dr. Art Singh, specialist dermatologist, and he is giving us some advice on vaginal relaxation syndrome. Very sensitive topic, not for the faint-hearted, and it's definitely not for sensitive viewers. And we did make mention, certainly not for 2 to 16 years. I think we're going to keep it that way because it's a topic that many would be having that taboo moment, like.
Yes and no. For example, you say it's not for 2 to 16 years, but I think the age of consent in South Africa is much younger.
It is, it is.
The second thing is these patients or these, how should I put it, the 2 to 16 years, one day they'll be the, what I would say, sort of victims of vaginal relaxation,
Yes.
especially when those who give birth. But at the same time, let's respect the privacy of the patients, and therefore the age restriction is well. But is taken note of. But what I also wish to emphasize that this is something that, as I mentioned to you, 25 to 50% of women have some sort of vaginal relaxation syndrome. You're looking at a population of 60 million, 30 million ladies, and if you look at it, those in the over the childbearing age, so I wouldn't be shocked to be about 5 to 8 million people who may be affected by this syndrome.
You are right, and there's many that have become parents at a younger age, sometimes below 16. But we're going to leave it as that. Who is affected by vaginal relaxation syndrome?
As I mentioned earlier on, it's generally the ladies over the age of 40 who are approaching menopause, and also the person who has given childbirth naturally. Not that those who give Caesars are not affected by it, but also very important, an ideal person who usually presents to you, or an ideal lady that usually presents to you, is a lady about 45 to 55 who is generally sexually active, and she's having problems with the urinary incontinence, and she also having problems with the menopause, and therefore with part of aging, and therefore these patients present to you and they wish to have some help because, for example, they do not, what I would say, the satisfaction that they had before has not been, is not the same because of aging.
So who is the right candidate for vaginal relaxation syndrome? How do you determine this?
You see, it's an individual response. Some people, for religious reasons or for various reasons, for example, if they become widowed or they become divorced or they become extremely religious, they decide not to do what I would say, have anything to do with sex after the age of a certain age. And it's not unusual to see that. So those candidates, they suffer in silence, and maybe they don't even need it. But those who are still, what I would say, active, sexually active, they are the candidates who generally need it. And generally, what happens is, if the partner complains about it, then they also want to. You must remember, people are living longer. People are even giving, as we mentioned, people are giving birth to children much younger, but they're also giving birth to children much older. I mean, just to give you an example, it's not unusual to find a 33, 34, up to 40-year-old, 42-year-old, up to 45-year-old pregnant now. But in those days, they would already be a mother of 5 or 6. But here is the first baby, because women have changed over the years, where they're putting career first and they're trying to reach the top of the profession before having children. So it's what I would say, a vast area. You cannot say that, you know what, this patient is going to have it. Another thing is, being a male, there is what I would say, a little bit of shyness. You do get a lot of women who come for help. But at the same time, the treatment that we use, not everybody has it.
Yeah, I do believe it's one of the first that you have.
It was one of the first in South Africa, but a few of my colleagues do have it. But it's extremely expensive, the equipment, but the treatment is relatively cheap.
What is the treatment for vaginal relaxation syndrome?
As mentioned to you, there are 3 categories of people who generally treat this. One is the gynecologist, but the gynecologists are extremely busy with a lot of the, what I would say, female pathology, because this is more aesthetic procedure rather than a pathological procedure. So what happens is, the gynecologists usually, they do the surgery, they strengthen the pelvic wall, and they try to make you as young as possible by strengthening the pelvic wall. But then people are very reluctant to undergo that type of surgery. That is the first treatment. The second treatment is, when patients give birth, you also tell the patients that they must exercise, especially the pelvic muscle exercises. And the pelvic muscle exercises do help, but it does not give you the strength that you had after the childbirth. You may achieve maybe 85 to 90%, but you will not achieve the same strength as previously. So what has happened now, you've got the new lasers. There are various lasers, especially the ones from abroad. We use a special type of laser, which we call, ironically, is known as intermalase. While lasing the vaginal wall, we can provide strength and we can remove the dryness, and also, most important, we can sort of reverse the aging to a certain extent. So the partner will appreciate the treatment that we're doing.
Okay, so doctor, we're going to take a short break, and to our viewers, we'll be back after this. Welcome back, and we are chatting to Dr. Art Singh, specialist dermatologist, and now something a bit different from doctor. We're chatting about vaginal relaxation syndrome, a very sensitive topic, but a topic that needs to be addressed, and a topic that needs to be also, people need to understand that this happens in reality, and people need to understand that we have to take care of it. So we're chatting about the treatment, and you gave us a tip as to how to do. So just follow through with that.
You see, it's not unusual for dermatologists to do this for the simple reason the new laser platforms allows you to do almost anything. Previously, you had to buy a simple laser for every procedure. Now you get a complex laser which can do 10 procedures. For example, you can do your hair removal, you can do your facial rejuvenation, you can do your tattoo removal, you can do your vaginal tightening, you can do, for example, other procedures to with it, like for example, your dark spots, your red spots, your melasma. So with the result, what you got is you got the single platform with many multiple heads. Each laser comes with a head. One of the instruments that we use, we can use that to strengthen the vaginal muscles. So basically what we're doing is just strengthening the vaginal muscle, and so much so that the person has better quality of life.
Better quality of life, and also builds up the confidence.
It builds up the confidence, improves the relationship with the partner. So, and also very important is that women want to feel younger. They can maybe bluff the face, etc., but if they have a holistic approach, they'll feel so much better.
Doctor, what is the success rate of this?
The success rate is that what's like with all aesthetic procedures, you should have very realistic expectations. What you must understand, the women are in the older age group, those who seek the treatment. Therefore, their success rate is anything between it's very difficult to measure success. So what we do generally question the ladies is they fill in a questionnaire, and they basically tell that the satisfaction index increases anything between 50 to 80% after 3 treatments. You can't get it after 1 treatment,
right,
but you need between 3 to 5 treatments, and maybe 6 treatments, and therefore the satisfaction index improves up to about 50 to 70%.
So I mean, realistically speaking, there's no ways like somebody walking in and doing the treatment and saying, after 1, 2 treatments, it's going to happen. It obviously is a prolonged time.
Yeah, what you must understand, what are we hoping to achieve? We're hoping to achieve is by strengthening the muscle.
Yeah.
It's like going to the gym. You cannot go to the gym one day and say, I'm going to be Arnold Schwarzenegger. You have to do it on a process, and generally people use a process. And I also mentioned to you that some people use estrogen creams, etc. They also help with the treatment and with the dryness, etc.
Does it help with urinary incontinence?
Yes, there is a special adaptation for the urinary incontinence. It's a pity that it's a bit complex. What happens is there is a special, what I would say, device where it has help with urinary incontinence. What you must understand is that lots of ladies do suffer from urinary incontinence. Obviously,
what is that? Could you just
urinary incontinence is where they lose control over the bladder as you age. So with the result, if you cough, you stain your underwear. If you sneeze, you stain your underwear. If you do anything that affects your muscles, that you can stain your
uncontrollable,
underwear.
eh?
Yeah, so with the result, you lose control over your bladder. So what happens is the urinary incontinence, while doing the vaginal laser, you can also use the laser whereby you alter the angle to a certain extent, and it does help. But I want to put a disclaimer. And I think very, very important that this disclaimer should be considered, that you need to see your gynecologist for your pap smear and also to do an assessment. You need to see your urologist if you have urinary incontinence, and maybe he might consider surgery. But if the gynecologist and the urologist gives us permission, then they come to us, those who have the laser. I think there's about 4 or 5 lasers in South Africa. I know there's a few in the outside KZN, and these treatments definitely help.
Yeah. Thank you, doctor. So, doctor, you've taught us so much about vaginal relaxation syndrome treatment, which is available with you currently and by appointment.
Yeah, it's by appointment, and what I'm trying to say to you is it's a topic that is in vogue. People are suffering from it, but the problem
They're
is
afraid.
because of, I wouldn't say afraid, I think because it's such a taboo topic. It was like mental health. I mean, people see a psychologist or a psychiatrist, like I mean to say, you can see an educational psychologist, but the minute they hear word in psychologist, you're going to see him for your learning disability. But they hear word psychology, they think you're mad. I'll just give you an example. If you could see a psychiatrist, they'll think you have some mental issues.
Yes.
So what I'm trying to say to you, people need to come out of the shell and seek treatment rather than suffer in silence. Because mental health, I would say 20, 25 years ago when we were medical students, you know, the minute you mentioned the word psychiatry, you looked at the person very strangely and thought, you know what, is there something wrong with this particular individual? But now it's not unusual to go and see psychologists for marriage counseling, for birth counseling, for post-traumatic stress disorders, if you have a hijacking or something. So what I'm trying to say to you, people should consider going for the treatment. And remember, that a lot of people don't want the treatment because for them, the vaginal relaxation syndrome, as I mentioned, is not really a life-threatening situation. But at the same time, they need to understand that those who want the treatment, there is help available.
So Dr. Art Singh, specialist dermatologist, here giving you the treatment that you need and don't suffer in silence. How's that?
Like everything, I mean, we're living in the world of artificial intelligence and everything is improving and the lasers are improved dramatically. So those who seek help can go and see the gynecologist, urologist or the dermatologist or plastic surgeon who offers this treatment, and maybe they can get some help. And I'm happy that the most important thing of this show is to make people aware that there is such a syndrome and there's help available.
Definitely. I think most of us have learnt a lot today and you've educated us on that. Doctor, thank you so much. We'll be seeing you again very, very soon on these interesting topics, getting us out of the forest and bringing us into where we need to be.
Yes, as I mentioned to you, Denver, it's always been a pleasure in being your show. It's surprising the number of ladies that come to us with this problem. Yes, there is a lot of conservative people who do not wish to go to a male, and then we try and refer them to a female, but unfortunately lots of the equipment is a little bit expensive, so in our province it's a bit restricted.
Okay, but doctor I promise you, everything is going to be safe and you're going to be well looked after and you don't need to feel that way. But join me next week when we chat to more influential people from around South Africa. My name is Denver Naika for the Get Real Talk Show.